Hi, and thank you for your interest in our training site. We are the senior clinical staff here at the CUNY Graduate Center Student Counseling Services, all trained as licensed psychologists. And we're going to take some time and take some turns answering some questions about the top 9 most frequently asked questions about our training site for you. Ariel, could you please tell us about our client population?
Thanks, Andrea. Sure. Hi, everyone. So there are many great things about our training site, and one of them is definitely our client population. We serve the 3,000 plus graduate students, mostly doctoral students, some master's students who attend the Graduate Center, City University of New York. They're both extremely diverse and extremely inspiring to work with. They're diverse in kind of all the ways that you can think in terms of program. They're in everything from biochemistry, physics, linguistics, English, history, journalism, et cetera, et cetera. They're diverse in terms of racial identity, gender identity, socioeconomic background, country of origin. We have lots of international students and other people from families who have, either first generation, second generation, 1.5 generation immigrants. We have, the whole continuum of the lifespan from young adult until, sometimes people come back towards the end of their lives. So I particularly I highlight the diversity because it really allows for such a richness of experiences working with diverse populations, and it's also something that internship sites are very interested in because it's in some ways more like an outpatient clinic than sort of the niche experience that you get in a lot of college counseling centers where you're just working with 18 to 22-year-olds. They're really inspiring to work with, partly because they're so motivated for treatment. They come to appointments, they think about things in between appointments, they come back with ideas. If there's homework, they do the homework. And they're kind of, many of them are social justice oriented. They're wanting to make the world better in the various ways that they're, studying about. And they're also, like, some of them, they're the first person in their family to be attending graduate school or even college. They're extremely resilient human beings, and it's an honor to work with them. And I am going to ask Nestor the next question, which is, what services do our fellows provide? We use fellows to refer to all people who are doing training at our center.
Thank you, Ariel. Hi, everyone. So the fellows offer a diverse array of services, including short-term individual and couples counseling. That's approximately between 10 and 12 sessions every week. These sessions are tailored to address the particular concerns of the students or the clients, and also like their interpersonal style. You may also offer academic consultations, which are 45-minute session spread over the semester, which addresses a particular concern or something that related to academics or an area where the client is stuck in terms of like their academic progress. In addition, you may also offer group counseling and participate in outreach efforts such as tabling and facilitating workshops. Andrea, what is our theoretical orientation?
Thanks, Nestor. So at our site, we strive to be as integrative and responsive to our client population as possible, and so that our trainees walk away with a well-rounded, adaptive, flexible training experience. And we really strive to think about how we can best show up for our clients and the work we do with them. So, unlike some training sites that might be strictly one orientation like CBT or strictly another like psychodynamic, we provide trainees with wide exposure to different kinds of orientations and approaches. So, for example, the first portion of our training year really focuses on TLDP, which is time limited dynamic therapy. And that is something that's incorporated in didactic trainings and also supervision, talking about conceptualization and treatment approaches from that lens. In the second portion of the training year, we focus a little bit more on CBT related strategies and integrating, different practices, again, to best meet the needs of our clients. Also in recent years, just based on feedback that we've received from our trainees or fellows, as Ariel had mentioned, we've also started incorporating more didactics geared towards group therapy and couples therapy, since those are big portions of some of the services that our trainees will provide. So we also, as we are responsive to our clients, we also try to be as responsive as possible to the folks doing our training with us. So those are some of the things that we would focus on during the training. Another aspect of our training program that I would highlight is multicultural humility. That's a very important piece to our work, and that's something that's incorporated throughout the entire experience at the GC. That's something that would be important anywhere, but particularly at our site. You know, we have students from all different kinds of backgrounds, populations, socioeconomic statuses, cultures, religions. We have a lot of international students also, that has been mentioned before. So that's something that we really emphasize is multicultural humility. And we as an institution, we are a city college, we are located in the city, we are a public university, and also very social justice oriented. So that's something that also is woven throughout all of our training, all of our didactics and supervision as well, that it will be an ongoing conversation that will be had in best service to our fellows and also our clients. Inez, I'm going to turn it over to you. Can you tell us a little bit more about the training program and who might be a good fit for our setting?
Yeah, thanks, Andrea. So as Ariel mentioned and Andrea just mentioned, we call our folks fellows. What that encompasses is that we have some students who are coming from different CUNY institutions and are doing fellowships with us sort of internally. And then we have our externship program. And so folks are coming from all the different programs in the city. What's really nice about that is that we have a pretty diverse fellow cohort. So there's folks coming from predominantly CBT programs, folks coming from predominantly dynamic programs. So it really adds to a richness, especially in our didactic series, our seminar series. So it's a lovely kind of hodgepodge of different perspectives. And I think people really learn a lot from one another and from their peers. Let's see. So in terms of supervision, you would get an hour of supervision from one of us internally. And you'd also get an hour of supervision externally from what we call community supervisors. So folks who are predominantly in private practice carry a wide range of different identities. And some of them have actually done fellowship with us. So they're very familiar with sort of what you're learning throughout the year with time limited treatment. And then you would also get anywhere from a half hour to an hour of group supervision because you'll be likely co-facilitating a group with one of us. And so you would be meeting either with us individually or with a couple of other folks in your cohort who are facilitating other groups with us as well. So that's really above and beyond the supervision requirement of other sites. So you're really getting a lot of hands-on individualized supervision. So just in the way that Andrea talked about sort of like how responsive we try to be to our clients and thinking about which approaches are most flexible in supporting them, we're also thinking in that way as supervisors. So we'll sit down with you at the beginning of the year and really get a sense of how you want to grow, what your strengths are, and really think through how we can support you to get the most out of your experience during the year. We also, so we have the Friday didactic series that Andrea mentioned. And in that meeting, I should say, we're saying Friday, but actually that's typically how we've done it. We may not actually do it on Friday this coming year, so stay tuned. But for our seminar series, we we'll take some time in the beginning just to check in with one another. So it usually takes about a half hour or so. And we really just all share kind of how we're doing, how our weekends were, how our pets or children or families are doing, big life events, how dissertation is going, research that you're involved in. So we really get to know each other as whole people and really foster a sense of community that we've consistently received feedback about from our fellows, that it's a special experience that they don't have at other sites, and that really creates an environment in which they've felt held, supported, as fellow graduate students, because you're doing the same stuff that that of the clients that we're working with. So we, you know, we want to get to know you, and you'll get to know us too. We'll share about our lives as well. I think that's everything. Oh, right. So in terms of a good fit, I think you're probably hearing who might be a good fit through what we're sharing, but essentially, I think to Ariel's point, folks who are looking for a really well-rounded outpatient experience, because we're not a college counseling center, we do just work with graduate students. It really lends itself, like for internship year, really sets you up for what you would see in an outpatient clinic, like all the diversity that Ariel mentioned. So I think that's a good fit of someone who's really looking for that particular kind of training. I think if you're committed to social justice and multicultural humility, we really do spend a lot of time thinking about our own identities, thinking about your identities as trainees and our clients' identities, sort of different power, marginalization, privilege structures. And so if that's something that you're committed to, interested in, perhaps want to grow in, it's a pretty important focus of our work. So that's another good fit. And I think just being flexible, you know, really being open to kind of expanding your toolkit, being curious about how to work in a more responsive, flexible way. Yeah, I think those are all the things that people can jump in if they think of others, but that's what's coming to mind now. Nestor, tell us about whether we're going to be hybrid or in person or remote next year.
Thank you, Ines. So in the past few years, we have been on site open Monday to Thursday. Friday has been remote. One important thing is that this is determined by the university. So there's, you know, we're part of a system, of a big system that will, you know, let us know how we're going to be working in terms of like a on-site or remote, and how many hours we can do for each days. Fellows should be able to attend in person Fridays if needed. And even when we're on site, we're providing like hybrid services. We'll say like 50-50, 50 in person, 50 like remote. You could definitely request more in person or more virtual if you have a preference. But this is something, you know, that we're going to continue offering in terms of like the hybrid services. The only difference may be if we're going to be able to work remotely or not, but, you know, we'll keep you informed of what decisions are made by the system. Andrea, what have former fellows found to be the most rewarding and challenging parts of the training experience?
Thanks, Nestor. In general, based on some of the things that we've heard from former fellows, there can be some challenges associated with working at a site like this. For example, identifying as a graduate student while working with a graduate student can present certain unique challenges that you might not get elsewhere. So some shared identities and working with someone who might be going through certain life milestones and challenges similar to your own might be something to navigate and work through with your supervisor in terms of just like how those shared identities are showing up in the work. Some other challenges might be with the short-term treatment format that might be new for some folks who might be coming from different settings where they provide longer-term treatment, or maybe even shorter term if they work, for example, in a hospital setting where they may not have, you know, the longevity of working with the same person over the course of several weeks. So sometimes there's adjustments that might need to be made around that, and maybe some associated challenges with regard to that. And then anything else in terms of like things that just have not been, you know, part of somebody's training experience before, like working with different populations or different presenting concerns, maybe some challenges that some fellows might face. On the flip side, the rewards, I think, you know, I would be remiss not to mention that one of the biggest rewards is just getting to work with our students. As Ariel mentioned, they're very inspiring. They, you know, work really hard. They're really bright. They have a lot going for them, and they're, you know, coming to seek services from us while, you know, just navigating being a student. So working with our students is definitely a big plus. and kind of the warm, environment and the warm community that we try to foster amongst ourselves as staff. That's something that we take, really to heart. And we, are constantly checking in with each other and having those, dedicated spaces and supervision and didactics just to create a welcoming, environment for our staff. And on top of that, just like the excellent services and supervision that is provided. I think we go above and beyond to provide even more supervision than would be required. So I think those are some big pluses for coming to our site. Ariel, is there anything else that you think would be helpful for potential fellows to know?
Thanks, Andrea. Yeah, I think we've shared a lot. The one thing that I was thinking maybe just to add is that we're very lucky that we're well resourced. So I know a lot of training sites are very under resourced, and that creates a lot of stress in the environment where you're kind of, as a trainee, really a workhorse, and your caseload is like loaded as tightly as it can be, and there's pressure to get lots of sessions in, and so we're not like that. You'll be busy, but also there's time to kind of pause and think, and we're able to give more supervision, like Inez mentioned, than is required. And training is a really high priority for us. It's a joy. And, so I think people have a really good experience with us because they feel, very held and supported, and not, just being a workhorse for a place. We're careful about not overburdening our fellows. So thank you for listening. Take care. We hope to get a chance to meet you during the interviews.